Okay, now we've seen a few neuromarkers associated with depression. And like I said, one of the issues with neuroscience in general is they're looking for a commonality across most individuals or all individuals, and how depression will manifest in an individual and show up in their behaviors may be somewhat different. So that's one reason why we do a brain map on every individual, see what's going on specifically with them. But this is a nice study. It used a lot of data. I think it was like 5,000 people from UK. And they found a reduction of the white matter tract, the coordination, the wiring in the callosal area that connects the occipital lobe. So they see that. We would see that as an orange or yellow occipital region. They found in what's called the forceps majors that was reduced its connectivity. They found reduced connectivity in this thalamic radiation called the superior thalamic radiation, which, if you know the brain regions, that goes up to, that's area 6 largely. And they also found the left superior longitudinal fasciculus was reduced in its connectivity. It's what's called an FA measure, and that's a language wiring, and also mood is affected because it hits area 9 up here. So we're going to show you how that also shows up in the EEG and different things that the SLF will connect to. Here's Broca's region in essence, and it goes back here, and now we hit the Greek, and for whatever reason, no longer using Brahmin numbers, but this is be 39 and 22, and maybe even 40. Let's look at an individual. Now, this individual has shown sign of depression. I know their parents, the father had unipolar depression, suffered all his life with it, so it wouldn't be unusual for the child to have at least the genetic predisposition, showing 50% of the genes. The individual is actually a little bit slow. Slower than you might think. We got recordings from, what is that, 27 years across. 3 different recordings. It would be great to have one for every year, but life doesn't seem to work out that way, especially when you're not doing government-sponsored research. And you can see we want to be around 10 hertz. This is how many frames per second the individual is doing in that region during the eyes closed condition. And it's staying on the 8 end. It's a little bit lower than you expect. You'd like to be at least up between 9 and 11 for adults. So this slower, but at least it's consistent. Consistency is even more important than speed. So very consistent. Things are changing. Here, this person does not have kids. Here, the kids are in high school. Here, the kids are in college. So kids are about to be born in this point. And so the different challenges going on with that. Natalie, as we're calling her here. Very well organized in terms of what the spectral plots. We want bell-shaped curves. Perfect. A little bit of the harmonics. Again, the harmonics are this extra energy to the faster rhythms, the beta range outside of past this to the right of the alpha peaks here. Think of the alpha peak as that's your agency, how much you're in charge. And when you're firing, your thalamic cortical system is firing a second time per sampling rate. It gives you a beta activity, a harmonic, and that's the amount of time you're ascribing agency to the environment being in charge, or something in the environment being in charge. Well, that's showing very little harmonics, a little bit in decision making. But overall very good, and staying very, you can see how reliable this parameter is. This measure has been 27 years and looks very similar. This is now the normative comparison of that data, and a little bit here and there it might be a little different. You can see the speed got a little bit faster. Pink is excess, blue is deficit. Got blue deficit in theta range all the way through here, and then you got some in the gamma and high beta range in the first and last map. But you see that little change in speed. There's a little bit faster. You can see the 9s here, 9.5s, but it's still slow compared to 9.5 is what you want to get up to, or 10, but still at 9, it's a little bit on the slow end. Okay, so, but as I've said before, the sensory system, which is the activity level, which reflects the sensory system, is a minor player typically in most mental health issues. And the major player is how much the subcortex is dominating a region. Subcortex will dominate a region when you see orange and yellows. We don't want to see that. So prior to having kids, and the person was returning to college, probably doing a lot of reading, and that's why the occipitals are so blue. Listening too. Blue is like, again, where you're putting a lot of your mental effort. yellows in the dorsolateral. Sometimes it deals with ambition and social group on the right side. Okay, so this is, you can see this is a different, as they're going from college, now they have kids in high school. You got they had an ADD a lot of the time. A lot of kids were out there in high school, and even maybe a little bit now. This can be associated with ADD, having the orbitals, which are governing your appetites. And you got this auditory on the right side showing some issues. We go to the back ahead, you can see the ADD marker, usually 7R, but sometimes 7L. It will be yellow in an individual who has ADD function problems, ADHD, over distractible by the environment. And that was the case with this individual. It has gotten a lot better in recent years. Some of it's been through taking of psychoactive meds to help deal with the activate your inhibition system to respond to that distractibility. Maybe also somewhat a lifestyle change. But we will see some commonalities here. And we're getting into now, this is the middle head. Now, area 6 is what that wiring diagram showed from the UK data, that area 6 was the superior thalamic projection was reduced. And if your wiring is reduced, your axonal wiring is reduced, we're going to see it as yellow or orange. And area 6, you can see, is yellow and orange all the way through here. And the person hasn't been fully suffering with depression all the time. This person did not come to us for depression. You can see, why would I have the map? They recorded for other reasons, but depression has been underlying the person's problems. The left SLF, the other wiring, would possibly have an influence, and it would have an influence in 22L, and probably as well as the auditory. All right, let's see. Now, go in the front end, we got some major problems here. This one, they're going back to school. Look at all this. We do not want all this reactivity, in essence. We don't want that orange. And area 9, you can see, is messed up in all cases, as is the 38s. Now, this person, again, did not come in for depression. They recorded for other reasons. Sometimes we see also the blue singulets, interior singulets, is a sign of emotional pain or physical pain. And could be a lot of emotional pain going on there. Wasn't so much when you were prior to the kids showing up. Now it's going on now. Also, it's monitoring the consequences. So when you have kids, you're worrying about what's going to happen to them. So I like to call it like a sidecar. So you're worried all the time, and that can show up as blue ACCs. Now, this person has just started neurotherapy out here in 2020. So it isn't the case. This is not a neurotherapy map of pre, post, mid, or anything. This is the pre out here. Just happens we have recordings from the past. Okay, so that person was showing a bunch of markers for depression. One of the things they were not showing is this harmonics. And we see that, but we do have, and the harmonics that look like this. We have more activity, usually times 2 times your alpha peak. So if your alpha peak's at 10, it's going to show up around 20. If your alpha peak 10.5, show up around 21. So usually around times 2. That's the thalamic-cortical system, the sensory system, following twice each sample unit. Usually every 100 milliseconds, taking a sample of the environment. Well, that's when you're in charge. If you're not in charge, you want to know what the environment's going to do. The things in the environment are in charge, and you're actually sampling twice every 100 milliseconds. So you can see, look at that. The alpha peak is lower than the harmonic in this individual who was suffering from depression. There's a sort of a general way to look at each of these regions, and but it's not the perfect terms. I should almost put quotes around each of these ones, because it's serving very specific actions, and we can get lost but this is the general terms. And this person, actually, you can see, has a little bit of harmonics. This person has more problem. This is another person I've shown before who has a lot of decortication, in essence, or excessive theta activity. This one did come in for depression and anxiety. Name we call AVA here in the study, and you can see a lack of alpha activity in the February. And you can see this is blue. This is the response to neurofeedback. And one of the things I was showing you, that previous 27-year difference, is how little changes in time if you don't have an intervention. And here's a case of this person should probably stay in that red view, decorticated, excessive delta, very little alpha in her decision-making areas all her life if she didn't come for neurotherapy, but came in for DNT, and within just a few months, boom, popping up the alpha. Now the agent herself, she is in charge in her decision making more. And even the harmonics have been reduced. You have this 2.7 harmonics, which is literally sort of 2 harmonics. We see associated with usually a single individual and being in charge, like one's mom. 2.7 is more like everyone's in charge. The environment's more in charge, and so it's a dilution of one's agency. And you can see that she got that dropped. Now she got more of a times 2. At least less activity there. And she was much better, much healthier. I'm not going to show any more about her brain map here, because I do have 2 other depressed cases. Now, these is 2 older women came in. One came in looking like an adolescent in terms of the speed. Some ways acted more adolescence, and then another one came in what you normally would expect. You get a little bit of slowing, usually around the low end of the 9 to 11 range is what you see in adults. This one was around 70. This one was around 60. And you can see harmonics going on. Look at all that energy that's out here in this beta range. And that's what we want to train. Remove that. And we started working and improving. In both of these ones, we don't have a post map. We various reasons. One left treatment, it felt much better than left. And then the other one was out here for an intensive just for a while, and was not going to stay around. So went back to her country. So it wasn't, we don't have post maps on either of them, but this is the starting state. You can see that's just looking at the normative analysis. There's the excessive frequency because of that adolescent speed in an adult. Usually you don't see 11s or 12s. This one, you can see pretty healthy there. How you see this now, looking at the overview, and this is probably a little bit of the that disconnection of this SLF and this individual. This one used to say I hated life, and you see occipital issues, and the occipital one's right there. Remember that was impaired. Okay, in the back of the head, you can see the occipitals are impaired in both individual area 17, especially 17R. 39s, that's involved in this SLF. It's bilateral. Some things in EEG, you can see one side's governing the other. Each side's governing each other, the homologue. And so if the one's impaired, the other side can be impaired. So we want to look at it as teams in a way. And we treat them, we fix them in teams. We put the electrodes on both. So we fix them as teams, so that's why it's not so bad to assess them as teams. Okay, here, as you can see, as I showed also in that long-term, the longitudinal study, you can see the 6s are really bad. And we know 6s can also mean you're usually invasive with others. It's a self-esteem issue. It's like usually a sign of narcissism. Not always. Sometimes people show, well, sometimes it's narcissism, but they'll show up as timid. Most people with the narcissism measure, which is associated with narcissism, will show up as invasive. And then, you know, I'd say in both cases that's true. And here's the front of the head, and you have your 9 messed up in this one, and the 38R, the 38L is messed up in this one. This is a case where we did DNT. The other ones we didn't have DNT. We not counting Ava. This is an individual who was depressed in the early 30s, showing a little bit of improvement in you can see the alpha peak coming through. Again, this is the minor player. We don't worry as much about changing this as we worry about the response system. Again, this is the sensory system. Now, here we go where we have the occipitals still showing the issues, but you can see this improvement getting green here in dorsolateral, and that's dorsolateral on the right side. Temporal lobe not being as severe. This is a PTSD marker associated with it. Typically, this comes sometimes of vulnerability, social anxiety. That's improving. This again is a mid map, and there was more to be done. This one's kind of unusual. Now we do sometimes see the 5s will go orange, and it's like a weird side effect of DNT, of neurofeedback, and that 5s we call your personal boundaries, how recruitable you are to others. And this individual sometimes after being improved, they don't think the world's a much better place, more kumbaya, and they become more receptive or recruitable to others. And so we just have to fix those. We just pop them back into place. And you can see the front of the head, where it was a lot of yellow. This is really the success in this case, much more balanced.